Hi, I'll be doing the talk on the prospective cohort study by Timmins et al. So first of all, before we start going through it, we've got to understand why they chose to do the study. And basically what they found was in their research that even though they found there was a lot of research done on hamstring injuries, there wasn't really a decline in any of the incidences in elite soccer. So when they did the research, they found that mainly there are two areas that the focus needs to be on, so non-modifiable risk factors, and in their research they found that with increasing age and increasing history, that was a good risk factor to determine whether or not the patient was going to get or likely to get an injury. So that was pretty good. But when they looked into the modifiable risk factors, what they found was mainly two things: eccentric hamstring strength, and they found that there was a decrease in future hamstring injuries in older athletes with high amounts of eccentric knee strength. And for hamstring fascicle length, they found that the lengths are shorter in uninjured muscles than in the opposite uninjured muscles. So what they did was they broke it down into these modifiable risk factors, and when they looked more deeply into it, they found that there wasn't really any consensus for the evidence, and there was a lack of direct evidence. So what they wrote was the purpose of the study was to determine the eccentric knee flexor strength and between limb imbalances during Nordic hamstring exercises, bicep femoris fascicle length, influencing the risk of future hamstring injuries in soccer players. So this is what they did in terms of their method. So basically they used the Australian football competition. There was pre-season and in-season from October 14 to May 15. 8 teams, 18 to 22 participants per team, 152 altogether. And basically they looked into a few things: so maximal voluntary isometric contraction strength, bicep femoris, the fascicle architecture. They're looking at two states: relaxed and then the isometric flexion at 25% isometric contraction strength, and then eccentric knee flexor strength. Also, when they looked at whether or not the athlete had a hamstring injury, they looked into any posterior thigh pain during the isometric contraction or a flexor muscle stretch test. This is the measuring of the burden as well. So they looked into the burden of the actual injury for the hamstring injury, burden of the hamstring injury to the athlete, sorry. They looked at playing time missed as a result, recurrence of the injury in the same season, and the total amount of days lost from the injury to the full training. Also, they classified modifiable and non-modifiable risk factors from previous injury to fascicle length, to fascicle thickness, to strength, limb imbalance, and then the ages as well of the athletes. And you can see here that they actually didn't just look into previous injury of one particular thing, but pretty much all lower limbs. And basically they've got a few variables within each risk factor. They also split it up into 5 different models to try and give you a better comparison of the non-modifiable risk factors to the in regards to the modifiable risk factors, which we'll go into a bit more detail later. What they found with the results was that out of the 152 athletes, only 27 of them had the injury, which is actually quite high. They've also found that the height and weight of the athletes that got injured didn't really determine it, but was mainly determined by age, which I guess confirms the previous studies. Out of the 27 injuries, 11 to 16 left to right, and 8 of them reoccurred. The total matches missed, you're looking at 63, which is an average of 7.8 per club, which is quite a high burden rate, with an average lost time of 17.7 days and 28.4 days for the reoccurring ones, which is very high as well. You're looking at majority of the injuries were bicep femoris, not the other hamstrings. Majority of the injuries in terms of mechanism were created by high-speed running rather than stretching or kicking. Recurrences were all from high-speed running, and then the chances of attackers getting it were much higher as well, probably because they were high-speed running. Second results, you're looking at the bicep femoris architectural characteristics. What they found was all the injured athletes had a shorter fascicle in compared to uninjured athletes. They found that the injured athletes also had shorter fascicles compared to the opposite uninjured limb. They also found that for every 0.5% increase, there was a reduction in injury rate by 73.9%. They also found that muscle thickness had no change, and also left to right comparisons also had no significant change. Third one was talking about the other modifiable risk factor. Basically, what they found was there was, in terms of between the knee flexor forces between limbs, there was no real change or no difference from injured compared to non-injured athletes. They also found that injured athletes had on average weakness in both limbs compared to non-injured athletes. And then for every 10 newtons increase in eccentric knee flexor strength, there was a reduction in injury rate by 8.9%. So looking at the 5 models, the first one's looking at the average passive fascicle length versus history. Then you're looking at the passive fascicle length versus age. Second model. Third model, you're looking at the eccentric strength versus history, and then the eccentric strength versus age. And then the fifth one is the eccentric strength and fascicle length versus previous injury. First one, you can see that the previous injury is quite high in comparison to no injury in the past, but as the fascicle length increases, it almost evens out back to normal. So that if you have a look at the finding, that's what they found. Second model, you're looking at the age groups. So the oldest ones on the top, most likely of getting injured compared to youngest, but again, as the fascicle length increases, it switches over. In fact, it gets even better than the younger athletes. So you can actually reduce chances of injury or incidence with an increase in fascicle length. Model 3. They also found that if you have a look at the previous injury compared to no injury, for hamstring strength, you're looking at weakened ones to have more likelihood of getting an injury, and as it gets stronger with eccentric hamstring strength, it evens out. And that's what they found here. Model 4, if you have a look at the different types of injuries, in terms of age groups, you're looking at the younger ones getting less injured and the older ones more likelihood of injury. And as hamstring strength increases, or eccentric hamstring strength increases, it evens back out, or it becomes much closer. And the fifth model that they were looking at, if you have a comparison of hamstring length, you can see the shorter ones are most likely to get injured and the weakest ones are most likely to get injured. But as the length increases and as the strength increases, it almost evens out again. That was a fourth finding. So the other findings that they had, that the authors mentioned, was that the between limb imbalances of eccentric and fascicle strength made no difference, and also that there was no difference if you look at isometric contraction, so you should focus more on eccentric. So in conclusion, you've got short fascicles plus weak weakness. Weak and short equals increased risk. Long and strong, decreased risk. Isometric or in-between imbalances have no change in risk. And non-modifiable risk factors, which we thought could not be changed, can actually be changed by modifiable risk factors. What does that mean in clinical relevance? That hamstring prevention strategies, you should consider two things. changes to fascicle length in terms of adaptation, and the eccentric strength, so giving the right exercises to try and increase length and increase strength. And also you must take into consideration when programming that the modifiable and non-modifiable risk factors and their relationship between them. So if they're older and they've had a previous injury, to focus more on creating a longer and stronger eccentric hamstring strength. Thank you.